A patient with suspected bacterial meningitis presents with photophobia, fever, and neck stiffness. What is the most appropriate initial nursing action? A. Administer acetaminophen and reassess in 30 minutes. B. Obtain a lumbar puncture immediately. C. Isolate the patient using droplet precautions. D. Start 4 fluids and observe closely. Answer: C. Bacterial meningitis requires droplet isolation immediately to prevent transmission before any diagnostic testing. Which ECG finding is most associated with hyperkalemia? A. ST segment depression. B. Peaked T waves. C. Prolonged QT interval. D. U waves. Answer: B. Peaked T waves are a classic early sign of hyperkalemia, indicating cardiac irritability. A 3-year-old arrives in the ED with stridor, drooling, and refuses to lie down. What is the priority nursing action? A. Suction the oropharynx. B. Perform throat examination. C. Prepare for intubation. D. Keep the child calm and sitting upright. Answer: D. Suspected epiglottitis, avoid agitation or throat exam to prevent airway obstruction. Which of the following indicates a basilar skull fracture? A. Battle's sign. B. Midline shift on CT. C. Pinpoint pupils. D. Nystagmus. Answer: A. Battle's sign, mastoid bruising, is a hallmark sign of a basilar skull fracture. In a patient with suspected abdominal aortic aneurysm, AAA, which is the most dangerous symptom? A. Left lower quadrant pain. B. Hypotension with a pulsatile mass. C. Constipation and nausea. D. Mild tachycardia. Answer: B. Hypotension with a pulsatile abdominal mass strongly suggests AAA rupture, a life-threatening emergency. A trauma patient with flail chest is deteriorating. Which condition is the nurse most concerned about? A. Atelectasis. B. Pneumothorax. C. Pulmonary embolism. D. Cardiac tamponade. Answer: B. Flail chest may lead to pulmonary contusion or pneumothorax, which impairs gas exchange and is immediately life-threatening. A 22-year-old female presents after sexual assault. What is the nurse's top priority? A. Collect forensic evidence. B. Notify police. C. Provide privacy and emotional support. D. Encourage detailed recounting of the event. Answer: C. The first priority is patient emotional safety and trauma-informed care. Forensic collection comes next. Which electrolyte imbalance is most likely in a patient with chronic vomiting? A. Hyperkalemia. B. Hypernatremia. C. Hypokalemia. D. Hypercalcemia. Answer: C. Vomiting leads to loss of potassium, causing hypokalemia. What is the most appropriate treatment for a patient with SVT and a pulse of 180 bpm, BP 110/60, and no chest pain? A. Amiodarone 4 push. B. Synchronized cardioversion. C. Vagal maneuvers. D. Lidocaine infusion. Answer: C. For stable SVT, vagal maneuvers should be attempted first before medication or cardioversion. What is the key intervention in a patient with DKA? A. Administer bicarbonate. B. Start insulin drip after fluids. C. Give 4-dextrose. D. Provide oxygen therapy. Answer: B. After fluid resuscitation, insulin is started to reverse ketosis and hyperglycemia. Which sign is most specific to pericardial tamponade? A. Muffled heart sounds. B. Tachycardia. C. Elevated BP. D. Crackles. Answer A. Tamponade. Classic signs include muffled heart sounds, hypotension, and jugular vein distension, Beck's triad. In the case of carbon monoxide poisoning, what is the definitive treatment? A. High-flow oxygen. B. Activated charcoal. C. Sodium bicarbonate. D. Naloxone. Answer A. 100% oxygen or hyperbaric oxygen is required to displace carbon monoxide from hemoglobin. A patient has pinpoint pupils, decreased respirations, and track marks. What is the priority intervention? A. Narcan 4. B. Intubate immediately. C. Insert 4 access. D. Restrain the patient. Answer A. Opioid overdose requires immediate administration of naloxone, Narcan. A patient exposed to chlorine gas presents with wheezing, coughing, and dyspnea. Which action is first? A. Apply oxygen. B. Give albuterol. C. Decontaminate the patient. D. Intubate. Answer C. Remove the source with decontamination first in toxic exposure cases. What is the hallmark of neurogenic shock? A. Warm, dry skin and bradycardia. B. Cool, clammy skin and tachycardia. C. Hypertension and sweating. D. Pulmonary edema and dyspnea. Answer A. Neurogenic shock causes vasodilation, warm skin plus bradycardia due to autonomic disruption. Which rhythm needs defibrillation? A. Sinus tachycardia. B. Atrial fibrillation. C. Ventricular fibrillation. D. Third-degree AV block. Answer C. VFib is a shockable rhythm requiring immediate defibrillation. A positive CARES sign is associated with A. Renal colic. B. Spleen rupture. C. Bowel obstruction. D. Acute appendicitis. Answer B. CARES sign, referred left shoulder pain, indicates splenic rupture. Which intervention is highest priority in tension pneumothorax? A. Administer oxygen. B. Chest tube placement. C. Needle decompression. D. For fluid bolus. Answer C. Immediate needle decompression is life-saving in tension pneumothorax before chest tube placement. Which triage level is appropriate for a patient with central chest pain and hypotension? A. ESI level 3. B. ESI level 2. C. ESI level 4. D. ESI level 5. Answer B. Unstable patients with potential life threats equals ESI level 2. A child with a barking cough, stridor, and low-grade fever likely has A. Epiglottitis. B. Asthma. C. Croup. D. Bronchiolitis. Answer C. Croup presents with a barking cough, inspiratory stridor, and viral prodrome. The primary goal during active seizure in the ED is A. Start 4-lorazepam. B. Protect airway and prevent injury. C. Insert NG tube. D. Obtain labs. Answer B. Priority in seizure care is airway safety and preventing harm. A patient with anterior chest bruising after MVC now has muffled heart sounds. What is the nurse's concern? A. Pulmonary contusion. B. Cardiac tamponade. C. Tension pneumothorax. D. Aortic dissection. Answer B. Blunt trauma plus muffled sounds equals tamponade from pericardial bleeding. Which blood test confirms acute pancreatitis? A. Amylase. B. Bilirubin. C. ALT. D. CPK. Answer A. Elevated amylase or lipase confirms pancreatitis. Which stroke symptom requires immediate recognition? A. Unilateral eye twitching. B. Sudden confusion and speech slurring. C. Dizziness with vomiting. D. Headache for 2 days. Answer B. Slurred speech and confusion equals fast stroke criteria. The most sensitive indicator of early shock is A. Narrowed pulse pressure. B. Cool extremities. C. Tachycardia. D. Hypotension. Answer C. Tachycardia is the earliest sign of shock due to compensation. What is the priority intervention for a patient presenting with myxedema coma? A. Administer insulin. B. Apply cooling blankets. C. Administer 4-levothyroxine. D. Give furosemide. Answer C. Myxedema coma is a severe hypothyroid emergency. Treatment includes 4 thyroid hormone replacement. A patient presents with altered mental status, flushed skin, and dry mucous membranes. Vitals, HR 120, BP 90/60, RR 10. Which toxidrome is most likely? A. Cholinergic. B. Opioid. C. Anticholinergic. D. Sympathomimetic. Answer C. Anticholinergic toxidrome includes dry, hot skin, AMS, tachycardia, and urinary retention. A patient with chest pain has ST elevation in leads 2, 3, and AVF. What area of the heart is affected? A. Lateral wall. B. Anterior wall. C. Inferior wall. D. Posterior wall. Answer C. Leads 2, 3, and AVF represent the inferior wall supplied by the right coronary artery. A child swallowed a coin. The X-ray shows the coin in the esophagus. What is the best immediate action? A. Induce vomiting. B. Emergent endoscopy. C. Observe for 24 hours. D. Heimlich maneuver. Answer B. Coins in the esophagus may cause airway compromise and require urgent removal via endoscopy. In a crush injury, what lab finding is expected? A. Low potassium. B. Elevated CK. C. Hypocalcemia. D. Decreased creatinine. Answer B. Muscle injury releases creatine kinase, CK, and potassium. Rhabdomyolysis is a major risk.